lot of women suffer from a lot of problems, female problems, and are contemplating hysterectomy. But there are a lot of worries about recovery time and the procedure and how soon am I going to be back on my feet. Well, you know what? These days the whole thing is so much easier. And Dr. Rob Southwick of Aurora Healthcare is here to talk about how we've come a long, long way as far as this procedure goes. And a lot of women say this procedure is life-changing, really is.
Well, thanks for having me to talk about it.
Thanks for coming. So let's talk about that. A lot of women who are done having children, they're done with their childbearing years, are really suffering with a lot of female problems that we've all been there, done that, and they might not necessarily need to.
Yep. Well, hysterectomy actually is really one of the more common operations in the nation, and the most common reason it's going to be done is usually because of problems with heavy periods, pain, painful periods. And fibroids are tumors of the uterus that aren't cancers but affect about 1 out of every 3 women. And traditionally the surgery in this country has been done through an abdominal incision, which has usually resulted in about a 6-week recovery time. And I think women are at the point now where they need to be asking their doctors if there's a better way.
Sure.
And fitting in with your theme today, there is. And that's where really GYN surgeons have kind of always had some minimally invasive options available to do hysterectomy, and now we can do hysterectomies through a laparoscope, kind of like the change we saw with gallbladder surgery 15 and 20 years ago.
Sure. So a woman comes in, first of all, she needs to talk to her doctor about these problems. I think a lot of people just think, I'm a woman, I'm just going to deal with it until menopause. And you don't have to, necessarily. I don't know, there's some sort of a guilt factor, I think, that women, they take care of everybody else and I'll just suffer through it.
Sure.
But a lot of people are going through a lot of suffering. I hear about it from a lot of my friends, and they're all, every month they're like, ay. So talk to your doctor about it. Second of all, let's talk about the day. You can actually get patients in and out. How quick?
Well, what we've been able to do now with laparoscopy is be able to do outpatient surgery for hysterectomy.
Wow.
And the reason we're able to do that is by just making 3 small incisions on a woman's abdomen, we're able to do everything we need to do through those incisions, and so the recovery time drops dramatically, the pain after surgery drops dramatically. And again, we're able to send probably about 9 out of 10 people home the day of surgery.
That is amazing. So you come in the morning, you have your surgery, then you let them rest, and they could be home that night.
Yep.
And certainly then up and moving, and possibly back at the grocery store and running the kids around to their schools and activities. And how long after the surgery?
Well, we've had the other change in all of this is that traditionally we removed the uterus and the cervix, and now with some of the technology that we have, we can remove just the uterus and leave a woman's cervix behind. And that's really allowed us to have women back to fully normal activities within a week. One of my favorite stories is a woman who within a week of surgery was on a cross-country motorcycle ride.
Wow. Wow. I mean, everyone's different. We're not saying, but that's best case scenario. We've got a picture here. What is the picture here?
Well, this is what most women think of when they think of hysterectomy, and this is an incision on a woman's lower abdomen that's a good 6 to 8 inches long. And you can just imagine that by making an incision that big and then having to separate the muscles to get to where you actually need to remove the uterus, it just makes for a much more difficult recovery.
Got some more pictures.
Now, before we had laparoscopy available, vaginal hysterectomy was the original minimally invasive procedure, and it's still much better than abdominal hysterectomy. And in the ideal world, we would do most hysterectomies this way, but in our country, we seem to have it the opposite. We do most of our hysterectomies through abdominal incisions. Next, they're showing the laparoscope, which is, I think, something most people are familiar with now. They've all heard of scope surgeries. And again, what we're able to do, what they'll show in the next picture, is where we are able to make 3 small incisions on a woman's abdomen as opposed to that one big long incision. And we're able to go in now and remove the uterus. And in the final picture, they can show that we'll just have the tubes and the ovaries and the cervix stay behind, and it's just the uterus that's removed.
Wow. One thing I think, too, women think about is the risks as far as I'm going under surgery,
Sure.
I've got kids and a family and a husband. Is the risk cut down with this this procedure as well?
Well, there is plenty of research now to say that with minimally invasive surgical techniques, there seems to be less bleeding. Operative time, depending on how many of these a surgeon has done, can initially take longer. But because you're making smaller incisions and there tends to be less blood loss, there is probably less risk with these procedures.
All right. Wow. Well, bottom line, if you're having issues, talk to your doctor about
Definitely.
it. Your whole life could change with
Definitely.
this relatively easy, simple procedure.
Yep.
Thanks so much, Dr.
All right,
Southwick.
thanks for having us.
Appreciate it.
All right, have a good
For
day.
more information, Aurora Healthcare, give them a call, schedule an appointment with your doctor, and Dr. Southwick and the other doctors would be happy to talk you through the procedure.